But good nutrition is very important for health, especially in times when the immune system is low, and it might be needed to help us fight infection or infectious diseases.
It's important to highlight that COVID-19 and non-communicable diseases coexist, and these exacerbate the prognosis of COVID-19 outcomes.
Improving nutrition during the first 1,000-day window is one of the best investments we can make to achieve lasting progress in global health and also development.
And I see food as a very sacred thing that is quite connected to the dignity of the people.
Avoid processed food. They put you at risk of overweight and obesity, heart disease, stroke, and other types of cancers. These conditions that I've mentioned, they are risk for COVID-19.
So food is that thing that helps us connect with each other.
Many people are aware that a compromised immune system makes them more susceptible to disease.
So a child can actually be accustomed to the diet that a mother is currently eating during the time of pregnancy and breastfeeding when they are still very small.
Food insecure people have limited choices. Therefore, they cannot afford to consume a variety of food. I mean those who are living in poverty. Fruit and vegetables to them is a luxury. It's not a necessity.
Our modern lifestyle, bad diets and environmental toxins, including both recreational and prescription drugs, systematically destroy this critical balance of our immune system.
I think we need to start at an early age, primary school. That's where we need to start educating the kids about, including the parents, of course, the families, as well as the children at the primary level, so that they know how to make healthy choices.
See that communicable diseases and non-communicable diseases are intricately linked, and as I've shown before, they are influenced by age, but also poverty we have to highlight, as well as the less healthful eating behaviors.
Very little is being done to educate people on how to improve their immune function.
Different foods and food groups give us different nutrients. So if we only eat one kind of food, we are depleting and depriving ourselves from other nutrients that we need.
It is important to know that our food environment is not making things easy for us to procure healthy food because of the ripeness of ultra-processed foods.
It has reminded us of the importance of food in our existence as humans, our interactions as human beings.
All this nutritional density enhances us to be best performing.
You cannot expect to perform optimally if you are not ingesting the right nutrition and the right fuel.
So we need to go back to the basic, go back to the olden days and work as communities.
Our animal products are laced with hormones and antibiotics. In South Africa, more than 50% of antibiotics are produced to give to animals. And
the cheap foods are the unhealthy foods. And I read a quote the other day that said, we should not be asking why is the food so expensive, the healthy foods. We should be asking, why is the unhealthy food so cheap?
All of the most unhealthy extra processed grain at the front, at the end caps of every shopping aisle, at the largest volume, 5 kilograms of pop, at the most inexpensive price point.
I think healthcare workers hold a huge responsibility. And unfortunately, a lot of healthcare workers are not educated in nutrition. They do not understand what nutrition is.
Take responsibility for your own health and your neighbor's health. We need to stand together and we need to support each other.
The type of food that people put, it's a reflection of how we think about the poor people at times. That's how I think. Because they don't have a choice.
But if we're not going to correct the first 1,000 days of life, we are going to battle to get it right later in life.
Nutrient-dense food is getting dumped while we are sitting with rubbish food. No, food that's not rubbish, as Lizanne said. I mean, that's not food. Food that's not food.
Have a conversation with communities so that they demand the healthy food.